Here we're going to demonstrate the insertion of nasopharyngeal airway as well as nasotracheal suction down the nasopharyngeal airway. Start off with, you've got different shapes, different sizes of your nasopharyngeal airway. Some come small, some are a little bit wider, some more narrow. Some of them have, all of them are going to have a bevel, and sometimes that bevel may open to the right or that bevel may open to the left. Nonetheless, you want to make sure that that bevel opens to the medial aspect of the patient's airway. So for instance, you've got three different nasopharyngeal airways, or they might be referred to as nasal trumpets, but you've got differences in how these bevels tend to open up. This bevel would be more geared toward going down the right narr, as opposed to where these two bevels, because they open midline, would be more geared to, excuse me, this was my right, talking about the patient's left. This one would go down the patient's left narr. These would go down the patient's right narr. You should try to be as clean and close to sterile with this procedure as possible, because you do have this is going to go in through the nares and then down to the back of the throat, so you're going to push that. You never want to push too terribly hard. You do want to make sure that you appropriately size your nasopharyngeal airway. So if I've got a brand new unopened nasopharyngeal airway here, for instance, what you'll do is you'll measure from the tip of the nose to the tragus of the ear. This one on this particular patient extends about that far, too long. So we can look at this particular one here, see if we can go through the tip of the nose to the tragus of the ear, and this one actually measures pretty well. Those are the exact same size, so I'm going to utilize the one that's packaged. And I know that's not unopened, but this is the package that I've got in order for this to work for the purposes of the demonstration of this video. I'm going to leave it up to you as far as you don sterile gloves for this portion of the procedure, and not just help keep it from going through several. You do have sterile lubricating jelly. You'll open that up. You can open up this package and you can squirt some lubrication into the package. This trumpet portion, or the flange of that's, never going to go inside of the patient. So you can take and run that, lubricate that trumpet up inside of your package. You want to make sure that the lubrication does not occlude the tip of your airway, because that is going to be, you want to make sure that airway is patent. Make sure that you've got the, and this one is going to open toward the medial side here, so I'm going to place this in the patient's left narr. Again, explain to the patient what's going on. You're going to feel a little bit of pressure in your nose, but this will help keep from causing irritation when we have to suction and clean your lungs out with the catheter, which we've been doing already. So holding on to the flange, we'll take your nasal cannula down for a moment. You're going to feel a little bit of pressure, and then you may have to kind of tweak it around. Don't ever force anything. You can cause a nosebleed, and then you can kind of press that right into place. Now there may be a little bit of extra jelly left over, and that's going to probably be uncomfortable, make the patient feel like they've got a runny nose. So utilize a napkin or tissue, kind of wipe that open. So if we know that we're going to do nasotracheal suction, the nasal cannula can fit back like this. You got free flow oxygen down that airway, or for the purposes of the duration of our procedure, you can take a non-rebreather. And when you're operating a non-rebreather, you want to make sure that this bag stays inflated even when the patient takes a breath in. If you've got complete deflation of this bag, you're going to need to increase your oxygen input to this. And so that you all can hear me, I'm not going to try to speak over the flow meter by turning it on, but you can hyperoxygenate your patient. And while you're getting your suction set up, your suction catheter ready to go, allow them to hyperoxygenate with 100% oxygen. So you've checked your chart, you verified that. We're just getting to the nuts and bolts of the actual procedure. I'm going to try to pull my tabletop into frame here. So I do have a suction system that's already set up. We can go ahead and test our suction pressure before we get sterile. Make sure that your suction or vacuum pressure doesn't exceed negative 120, so you should be negative 100, negative 120. So we can tweak that a little bit if needed. So I've just set it at just over negative 100 millimeters of mercury. And we are good to go as far as suction is concerned. So now I can set this aside, explaining to the patient what's going to be done. Going to take the catheter, we're going to go down that airway that we just placed in your nose. We're going to go down and kind of cause you to cough, clean your lungs out, and suction that out. Right now you're receiving a little bit of extra oxygen just to build it up beforehand. All the while you're monitoring heart rate, respiratory rate, blood pressure, breath sounds, and everything of that nature. You may need some water, some sterile water, so you have that done. You may also need another packet of lubricating jelly. These suction kits are going to differ a little bit. I'm going to turn this off just for the time being so I don't have to speak over it. These suction catheters or suction kits are going to vary a little bit with what they've got in them, but nonetheless, the contents inside of this suction package, as long as there was no tear, rip, hole, or anything in it, the contents inside of this are sterile, and we want to try to keep it as such. Inside of this one, you've got a little box that you can utilize. You've also got a suction catheter, and this one's going to come complete with a set of sterile gloves that we can utilize. So I'm going to go ahead, in the event I decide that I'm going to need to utilize the water, I'm going to go ahead and break the top of the water while I'm clean, because with my gloves on, I'm considered just clean. So I'm going to take that, and now I'm going to open up my suction catheter kit. And you want to make sure that you open this up in a way that you maintain everything in the contents of that package sterile. So being careful not to touch anything else inside of this package, go ahead and get your sterile gloves out. Your sterile gloves are packaged in such a way to where you can open those and maintain a sterile field. And it's going to be important that you maintain your sterile field. Or if you anticipate needing surgical lube, you can absolutely squirt that in. I'm hoping that with the conduit that I've got going down the nasopharyngeal airway, may not have to lubricate it too much, if at all. I'm going to squirt just a little bit in there and seeing how this one was over. We'll pretend that I'm opening this one just so that I'm not wasting our supply. But you can go ahead and squirt sterile jelly inside of your pouch here. So now that you're about ready to proceed with your sterile procedure, once you get sterile, you're going to have a sterile hand and you're going to have a clean hand. It's up to you however you want to operate to do that. I'm going to go ahead and turn my vacuum on. I know I checked it already, but I'm going to take a peek at it once more just to make sure that I'm not exceeding where I set it at, and we are good to go. So these hands are technically clean, but they're not sterile yet. So I'm going to go ahead and put on my sterile gloves. Making sure just to touch the insides of the cuff, because the outside of these gloves are sterile. And notice I do have other exam gloves on, and I'll tell you why I do that here momentarily. Now, this hand is sterile, this hand is clean. It could be up to you if you just put one sterile glove on and utilize your clean hand. I'm going to go ahead and have both hands sterile, though, just for the purposes of demonstrating this. Take your two fingers and kind of get up under the cuff of this other set of gloves. Now you can take and work your fingers into the holes, keeping the gloves sterile. So your gloves are still sterile. Now at this point, I can touch anything with both hands inside of this package because everything is clean. So what I'm going to do, I'm going to pick my suction catheter up. I'm going to leave it in its sleeve, and I'm going to pull this little tray out. Set that back. This little tray is lined with plastic, so I'll take that out, and I can go ahead and fill this with water. or I can fill it with water here momentarily, but I'm going to set that to the side right there. Now with both hands, I'm going to get my suction catheter out, and I'm going to go ahead and fix it, and make sure you control the tip of that catheter so that it doesn't inadvertently touch something that would make it no longer sterile. Because once you go into the patient, this is technically no longer sterile, but it's sterile to this patient. So I typically take and pinch that in between those two fingers and wrap the catheter around. That way I can attach my suction tube in here, and then this hand eventually is just going to become my clean hand, and this is going to maintain my sterile hand. So what I'm going to do with now I've touched this bottle, no longer sterile, with my left hand. I'm going to go ahead and fill my cup up with a little bit of sterile water. So now you can go ahead and take your suction tubing, press it in here. Everything here is still sterile, and you've got a suction port. So when you're ready to apply your suction, you're good to go here. So now what I can do is I can test to make sure that the catheter works. And it does. If you find that, with just dipping that in water, that may be enough going down the nasopharyngeal, because you just don't want to put a lot of the jelly. You just don't want to put a lot of the jelly in it, because you don't want to occlude the nasopharyngeal area, because the whole purpose of putting that nasopharyngeal airway in there is so that you've got a patent airway for free flow oxygen, what have you. So throughout the purpose of this demonstration, my patient's been hyperoxygenated. I'll explain to him getting ready to go down that airway that I placed in your nose, and we're going to suction your lungs out. It's likely going to cause you to cough or what have you. Go through it. So what I can do here is I can take this and I can pull it down below. You could take it off altogether, or you could just pull it down below the chin. Because of the rubber on this mannequin, it's going to slide a whole lot easier on skin and hair, but because of the rubber on the mannequin, it was gripping a little bit. So now I'll tell the patient we're ready. Make sure that you've got the patient's head aligned in the sniffer's position that you like. This patient's in semi-Fowler. The head is aligned relatively well, and I've got the nasopharyngeal airway in place. I shouldn't have any problem doing this. I've assessed heart rate, SpO2, and we're ready to go in with our suction procedure. Making sure that you go down the center of the nasopharyngeal airway, advance that catheter until you meet your resistance. Now on this particular mannequin, I'm going to hit resistance just because the things are rubber down, so I may not be able to get down as far as I can, but on a real patient, go down till you meet resistance. Your patient's going to begin to start coughing. So now apply your suction, and suction's only applied coming out, not going in. Apply your suction. You can rotate your fingers to wiggle the catheter around a little bit. You've got 15 seconds to pull out. And actually, I may have gotten down far enough because I pulled more catheter out than I thought I'd pushed in. And now I can still hyperoxygenate my patient while I'm maintaining a sterile hand if I decide that I need to make a second pass. So if I decide I need to make a second pass, my patient's been pre-hyperoxygenated again, I can now take this down. We can go through and suction again. Make sure that you don't let that slip out and touch anything that it's not supposed to, because you want it to be sterile to your patient. Meet your resistance, pull back, apply your suction, withdraw the catheter, rotating the catheter around, and now that you've got the catheter back out in your hands, wind it back up, just because that catheter can fling around and touch whatever. See, now I've let that go and it's no longer sterile. So I'm not going to use this catheter anymore to go down to this patient. You can hyperoxygenate your patient. While they're hyperoxygenating, what I do is go ahead and turn my vacuum off. And one thing I want to show you, the reason I put the sterile gloves on top of my regular exam gloves is so that I can take this catheter and rotate around, because when you pull this out of somebody's nose, you're going to have snot, boogers, blood, whatever else in between your fingers there. So, and you're going to be in a patient's room and they're still clean up. I'm still going to have to take this non-rebreather off the patient, put the nasal cannula back on them. So I can take this glove off while that catheter is left inside of that. So now I've got two clean gloves that I can still do what I need to with the patient. So now that I've allowed them to hyperoxygenate, I'll assess breath sounds again, heart rate, blood pressure, SpO2, I'm going to tell the patient this will be left in place because we may have to suction again in the future. Return the patient back to the original FiO2 that they had. This patient was on 2 liters beforehand. Make sure that your cannula is going in the right way. And then you can get that looped around the ears and hold it in place. And hold that in place. And you've got, it's going down one there, but it's also free flowing down the nasopharyngeal airway that we've got. Then you clean up your mess, throw it away, and that's how you do nasopharyngeal insertion as well as nasotracheal suction while we're here.